Good afternoon, everyone. Welcome to the latest edition of the Berkeley Conversation Series. I'm Laura Tyson. I'm a distinguishing professor at the graduate school and with the Haas School and the executive director of the Institute for Business and Social Impact. In today's talk, we're going to be focusing on how different countries, a group of countries called the Nordic countries, are dealing with the economic, health, and other public policy challenges of the COVID epidemic. I'm very pleased that we have two outstanding Berkeley faculty experts to help us in this conversation. We have with us Dr. Robert Strand. He's the executive director of the Center for Responsible Business. He's a lecturer at the Haas School. He is one of the world's experts on the Nordic economies, on sustainable business in the Nordic economies, on the sustainable development goals and how the Nordic economies are moving to achieve those goals. He focuses on socially and sustainable, responsible business. There's a lot of discussion about, is this the end of capitalism? He's actually focused on varieties of capitalism, and it turns out that there are a number of very successful capitalist societies organized differently from ours throughout the Nordic regions, and he'll be discussing that. We also have with us Dr. Ann Keller. She's a professor of health, politics, and policy at the School of Public Health at Berkeley. She focuses on the politics of science and expertise in public policy, particularly in the environmental area, the health area, and technological innovation. This is a very interesting perspective to bring to this discussion because she really is interested in the nature and use of scientific knowledge and technical expertise in making wise public policy decisions in technology, in the environment, in health. And obviously this has become a huge issue in the United States, the role of experts, the role of scientific objectivity in making policy. We'll also hear about that in the Nordic economies as well. So I'm going to start our conversation by asking each of our faculty experts to share some of their thoughts. The way we've organized this will be about 20-25 minutes of our presentations and discussions with one another, and then we'll open it up to discussions from the audience. So let me begin with Robert Strand. As I mentioned, an expert on the Nordic economies and Nordic societies. So Robert, why don't you begin giving us some perspective about why these economies are handling a common pandemic differently, different from one another and different from the US.
That's great. Well, thank you, Laura, very much. And it's also such a pleasure to be here with you. And if I could then, Laura, maybe I'll just say a few words here, just the Nordics. What are we even talking about when we say that? And we're talking about Sweden, Denmark, Norway, Finland, and Iceland. They're separate countries, but through the Nordic Council of Ministers, they harmonize policy to various degrees. And just about 5 or 6 generations ago, the Nordics were among the poorest region in Europe, where a third of their population fled because they were impoverished. And that included my great-great-grandfather and grandmother from Norway. Yet today, the Nordics demonstrate among the highest well-being in the world. And all the classes that I have the privilege to teach at UC Berkeley focus on how the Nordics perform so comparatively well in measurements like the Sustainable Development Goals Index. So every year I take groups of Berkeley students to the Nordics to explore this firsthand. And before we take off, though, without fail, a statement along the following lines will come up. Yeah, but they're small. Or yeah, but their populations are homogeneous. And in response, I'd like to point out that these same countries were smaller and far more homogeneous those 5 or 6 generations ago. So it seems very relevant for us to ask the question, what did the Nordics do in the 20th century? And when we ask that question, then we begin our journey to consider these differences of capitalism between how the United States and Nordic countries have constructed very different varieties of capitalism. And to be just crystal clear, when we say capitalism, what we mean by that, of course, is private ownership of capital, the so-called means of production, to use Marx's terms, and a reliance upon markets to set prices. So both the US and the Nordics represent, in fact, capitalistic societies. And I feel the need to stress all this because the word socialism often gets thrown out there here in the US, and I would suggest rather carelessly when we talk about the Nordics. And I think that it prevents us from learning some potentially powerful lessons. Now, so the Nordics are capitalistic, but they've elected to move some activities outside the domain of markets and instead provide them universally to all citizens. So this includes education all the way through the end of university, paid parental leaves, disability, sick pay, and very importantly, of course, healthcare. All Nordic citizens are universally provided these services. Now, this speaks, of course, to equality, but it's also important to stress efficiency because the Nordics are obsessed with providing these services in an efficient manner. And they've long recognized that if they don't have strong and robust economies, they couldn't pay for these universal services. And this is why I think it's important to stress that we're not talking about socialism here. And the Nordics have also, they've constructed what has become to be known as flex security. And this is the idea of achieving security by being adaptable, by being flexible, by being resilient. And Nordic labor markets are very flexible. Folks can be fired and hired rather easily. Job training's offered, and given that universal education is available, folks can rather readily move back and forth and take university training later on in life. And importantly here, because healthcare is not tied to an employer, which of course is often the case in the United States, the fear of losing one's job is not coupled with the fear of losing one's health insurance. And this is a huge difference for the conversation at hand. In the Nordics, these universal offerings are often discussed as enablers of freedom and as enablers of resiliency for Nordic societies and individuals. And here I see a fundamental difference also in the idea of freedom between the US and the Nordic context. Where in the US, we characterize freedom as something that's achieved by the individual and through sheer individualistic will. In the Nordics, I hear more discussions about what systems are needed to enable individuals to achieve autonomy and to be free to make their own choices. Now, of course, Nordics indeed pay comparatively higher taxes for these universal services, but most Nordic citizens are generally okay with it because they feel like they're getting quality services for what they pay. And in the Nordics, the discussions are not often about the rich paying for the poor, but it's about the middle class paying for itself. And this week in the New York Times article, I'm guessing that a number of participants have saw a Nick Kristoff's article comparing McDonald's workers in Denmark versus the US. And Kristoff points out that the McDonald's workers in Denmark make about $22 an hour, get 6 weeks of paid vacation a year, life insurance, paid parental leaves, pension plan, paid sick leave, and that universal health care. But an important thing to point out is that $22 an hour, it's not because of any minimum wage laws. Most Nordic countries don't have minimum wage laws. They don't need them. That $22 an hour is a result of collective bargaining agreements on behalf of those workers' labor unions. Labor unions play a significant role in the Nordic context. But the culture is rather different, as there's much more of a consensus culture between the labor unions and employers in the Nordics than what we see more of a conflict-based relationship here in the US. And there's more of a consensus-based culture then between government as well as employers and labor unions that we see in the Nordics. And that enabled them to move quite quickly in response to the COVID crisis with response to employment and unemployment packages. So, Laura, these are just a few of the key contextual differences that I think are relevant for our discussions today.
Well, thank you, Robert. I want to just throw one thing into this, which is I've looked at numbers which suggest that if you look at inequality, which is related to all of this, that on a pre-tax and a pre-transfer basis, these policies, these societies look as unequal in terms of income as in the United States. So the inequality from the market looks rather comparable. It's just that what these societies do through taxation and all of these policies is they make the post inequality, post their policies, much reduced. And I think that's really important because they're not getting away from the inequality of the marketplace itself, but they're offsetting that. Let me turn to Anne. Anne, Why don't you bring us up to date in terms of some of the major differences in health, the health of the population, and the healthcare approaches of some of the Nordic countries and the United States?
Sure, I'd be happy to do that. I think it's especially interesting to think when we think about how countries are responding to the pandemic is to think a little bit about what's their baseline, where do they start out? When we experience a pandemic of a novel pathogen, we oftentimes have very few tools to intervene. We, as everybody I think who's been following this recognizes, we don't have a vaccine right now. We're eagerly anticipating having one. And there's no available treatment other than supportive care for people who get very sick from this disease. So countries are faced with trying to figure out what is, knowing that we don't have immunity to this novel infection, knowing that it's spreading around the globe. What are the opportunities that countries have to intervene? And I think so. And I think that when we look at the Nordics, they're doing things that look different from what happens in the United States. And implicitly, there's a comparison there. But what I thought I would do is try to point out that they're not all, these countries aren't starting from the same place. So let me just briefly, I'm going to share some slides with everybody. I won't belabor these too long. But I wanted to give people a little bit of a baseline for thinking about how, there we go, for some of the ways that the US differs from its Nordic counterparts. And in preparing for this, I've been focusing very much on the policies of Sweden's response to COVID-19 as well as Denmark's. So those are the countries, those are the two Nordics that I'm highlighting in the slides here. So let me share this. So these data come from, these are OECD data, and this comes from a report that I have that I can share through the slides. So the United States has always been an outlier in terms of how much money it spends on its healthcare system, or on healthcare in general. And as you see, that the top of this, if it's not clear, the very top line shows that the United States spends 16.9% of GDP on healthcare. Denmark, which wasn't initially on this slide, so I've added it, is at 10.1%, and Sweden is at 11%. So we spend more on our healthcare compared to our other OECD counterparts. Sorry, and then at the same time, the US has lower life expectancy. And you can see here, I've added once again Denmark, and that wasn't part of the original slides. The life expectancy in Denmark is 81.1. Sweden is 82.5, so just a bit higher. But in the United States, life expectancy is at 78.6. So we're spending more, and life expectancy is a very rough way of measuring sort of the health of a population, but it is a measure, and an important one. And one thing I think that's captured here is that life expectancy in the United States is currently going down, which is really the first time, I think, probably since the early part of the 20th century, that we've seen life expectancy in an advanced industrialized country decline. So that's another thing to point out there. The United States also, I think, in comparison with the Nordics, starts out with a higher burden of some of the diseases and risk factors that make people in the United States, or make anyone, vulnerable to the disease itself. So this is a table that shows rates of obesity among several OECD countries. I added just a statistic, a second picture in here from Denmark, so you can see where it falls as well. So in terms of percentage, the US has 40% population obesity, whereas Sweden has 13.1, and Denmark has 17%. So I also wanted to add a picture of chronic disease burden. Obesity isn't the only thing that contributes to chronic disease. So this slide also shows chronic disease burden. You can see the US here on the right-hand side of the slide at 28%, where Sweden is at 18%. And I added a couple of measures in here for Denmark. They're not counting exactly the same chronic diseases, so these aren't exactly comparable. But for a US comparison with Denmark, if you look at the percent of people over 65 that have at least one chronic disease, 80% of those in the United States have at least one. And in Denmark, the percentage is much lower, it's at 50%. I'm just trying to give some rough figures for thinking about chronic disease burden in the population. The United States also has among the highest rates of hospitalization from preventable causes like diabetes and hypertension. You see here on the right-hand side of the slide something that's a little bit uncharacteristic. Germany actually has higher rates than the United States, but the United States is certainly is up there. And in this one, I couldn't get exactly the measures for Denmark here, but you see Sweden is actually much lower down in terms of the hospitalizations that come from preventable diseases like diabetes and hypertension. And this suggests something about how the healthcare system works, that if you're ending up for hospitalizations for these diseases, that suggests that people who have these diseases aren't having the diseases well managed to prevent them from entering the hospital in the first place. So that's sort of a measure of how effectively countries are able to take care of chronic disease within the population. I also included a measure here just of the practicing physicians per 1,000 people in the country to give a sense of capacity. One thing you want, and I think we've probably heard a lot about, is capacity in terms of being able to treat people who get infected with COVID-19 and then have complications from that disease. So this shows that the average number, the number of hospital beds per 1,000 population in 2018 in many OECD countries. And the US here is at 2.6%, whereas Sweden's at 4.1 and Denmark is at 4.5. So just more physicians available for the population in the country. I wanted to just give a little bit of a picture of the epidemic as well. And what you see in the graph here is that the United States has many more cases than either Sweden or Denmark, and Sweden has more cases than Denmark. And I also wanted to normalize this a little bit. So how many cases per million population, because the United States is a much bigger country. But you can see even when we normalize this for the million people in the population, the US is at 4,190 cases, whereas Denmark is at 1,798. I also included the death rate, and here what might pop out at you is that Sweden's death rate looks much higher. But I'm going to just show on the next slide that Sweden is testing fewer people. And so part of Sweden's, part of what looks like the high death rate here, I just divided deaths by confirmed cases. If Sweden is picking up fewer cases than Denmark and the United States, that will automatically inflate the death rate in Sweden. And as we see here, Denmark is testing at a higher rate than the United States or Sweden. Sweden actually is the lowest here in testing. And when we talk about the country's individual responses, I can shed a little bit of light on why I think Sweden is testing so much less than other countries. This gives the testing rates among Nordics, and you can see Sweden's low there, Iceland's high, and Denmark comes in second. And I think that may be, I wanted to also sort of give a sense of whether or not are cases still increasing in these countries, or what is it? Are we bending the curve, which is what everybody's hoping that sheltering in place would accomplish? And I think you can see that there's, the United States curve is quite a bit steeper in the early part of the pandemic than in either of Sweden or Denmark, and the cases are flattening out and look like they're declining more in Denmark than either Sweden or the United States. I think that's my last slide. Oh, this slide also shows how close. So if you can see the gray markings here, this gives you a sense of how quickly, how fast are cases mounting. Are cases doubling every day, every 2 days, every 3 days, every 5 days, out to every 10 days. The US is approaching cases doubling every 5 days, but Sweden and Denmark are closer to probably, I would guess that's probably, they're getting around closer to 7 or 8 days for doubling of cases. So that gives a sense for how much transmission, or how active transmission is currently. All right, I think that's the end of my slide, so I'm going to stop sharing my screen here.
Thank you. Thank you.
Great.
So let me first of all just ask a quick question, because you said you could say more about it. So there is this difference in testing, and we're going to hear a lot. There are a lot of questions maybe out there. There's a lot of press about the particularly distinctive Swedish response to this. What explains that difference in testing? So in the US, we're focused a lot on really, to get reopening right, we've got to do more testing. We're not doing enough testing. Sweden didn't really close down the same way, and they don't have testing. So how do you explain that?
So let me just say that in the way that I'm sort of thinking about how countries are responding is I'm thinking of, are there sort of typologies of response? And I think I think that there there are somewhat typologies. Each country is sort of mixing up the way of intervening in slightly different ways. But let me just see if I can quickly lay out what I think are some distinct ways of doing this. So the what I'll call sort of containment out of the gates is what South Korea was trying to do. As soon as South Korea had one case in the country, they turned to testing and they started to develop tests. And they were one of the countries to really rapidly expand their ability to test people. They're also a country that innovated the drive-through testing so that people didn't have to go to medical centers and be around other people who were very sick to get tested. They could stay in their cars. And what I think South Korea's tried to do is it's tried to keep community spread of the disease very limited by testing people. They also share data using people's cell phone data and tracking, where they can show the rest of a city. This is where people who have tested positive have been in the last several days. So you would know if you had overlapped with any of those people in those places. And they're really trying to kind of contain it out of the gates. I think many other countries, in the US in particular, fit a model which I'll call pause plus containment, where pause is shutting everything down. Everybody has to shelter in place. Limit mass gatherings, try to keep people from really just interacting with anyone beyond their own immediate household, and try to keep people from going out much at all. And obviously we've seen that has enormous consequences for the economy. But the idea is that eventually, if you can get transmission down low enough that your hospitals can manage the level of sickness in communities, that you could begin to adopt a strategy that looks a little bit more like what South Korea is doing, where you test very widely, and every time you find someone who is positive, you do what's called contact tracing. You find out who all their contacts are, and you try to get those people to stay home and not infect other people. So that's the pause plus containment. And I think what Sweden's done that stands out, and Germany has a sort of slight variation on pause plus containment that we can add in if that comes in. But let me just jump to Sweden, because I think it sort of stands out as the most uncharacteristic. They never hit the pause button. They decided that what they should be doing is they should be allowing the transmission to happen among the part of the population that's most healthy and young. Because most people who are healthy and young don't get very sick from this. And I think the idea is that you try to keep people who are older and potentially have some chronic conditions you keep those people away from where transmission might be happening in the community. You ask them to stay at home. And I think a sort of second step in Sweden's approach was to really try to protect elder care homes, because they didn't initially do that. And that's where they had a lot of deaths. In fact, 50% of Sweden's deaths have come from people who were in elder care homes, because they didn't sufficiently shield elder care homes from the rest of the population. But they've essentially said, we want to achieve herd immunity. And the way you get herd immunity is you get your healthy population who can withstand this disease quite well to get exposed. And they've done a number of things. They certainly tell people, if you know you're sick and you have a fever and you're coughing, stay home. So they're not telling people who have the disease to go out and infect other people, because they also don't want to get to a point where the infections are happening so fast that they're overwhelming their hospital system. So Sweden's model, I think, is very different in that sense. That might explain why they don't feel like they need to test so much, because if they've successfusly been able to isolate the people who are most vulnerable to getting very sick or dying, then the people who are getting the transmission, like, that's the goal. They want herd immunity. So they're not testing in the population broadly, because they're not actively trying to contain the spread. They're trying to allow the spread to happen among the least vulnerable part of the population, and to have it happen at a pace where, I think you can't adopt that strategy and prevent everyone from getting sick and or dying. So you need to, if you're going to approach that strategy, you need it to happen at a pace where, when people do get sick enough to be hospitalized, you have the hospital capacity to care for them. Right. So that's why I think there's not pressure among the decision makers in Sweden to get their testing rate up, because they're really just not trying to find every case.
Right. I think that two things. I'm going to turn to Robert and ask him about the role of trust in all of this. In Sweden, they have actually publicly admitted that they failed on the elder care. So essentially, they take responsibility. We didn't get the elder care part of this right. We have to change things, and they are changing things. The other thing related to your presentation is this society had a lot of capacity there already. It didn't have vast inequities in the health of the population. So actually it was a healthier population with more capacity to deal with this. So I think that's important as a starting point. Because all that spending in the US on healthcare, if you go back and look at inequities here, you see there's a whole bunch of spending at the upper income group level, and there's not a lot of spending at the lower income group level. So we spend a whole bunch, but we don't distribute this access equally at all. Let me turn to Robert and ask about something that's discussed a lot in both the Denmark response on the economy and the Swedish response on health, and that is the importance of trust. Trust in the institutions of government, trust in one another, trust between workers and their employers, trust. Whereas in the United States, we have this huge politicization of the whole thing. So Robert, talk about trust.
Well, I think this is such a fundamental point, Laura, and just to pick up on where you left here, the politicalization of this.
It's impossible.
This is something that we see in a US context where wearing a mask is a political statement, one way, or not wearing one. And we're operating in a very different context in the Nordics. And as Anne appropriately pointed out, Sweden has a different response than Denmark in many respects, but they're both drawing from a comparatively similar well of trust. Very high levels of trust. So every year when the World Values Survey does its annual, just a simple question, do you trust the average person on the street? The typical response is about 70% of people in a Nordic context say yes, and comparatively speaking, it's normally around 30% in the US. And then when we talk about trust in your institutions and your democratic institutions, then we see similar responses, but it's even stronger, higher levels of trust in the democratic institutions of the Nordic context. And that is when we talk about a crisis that comes on and hits the world so quickly and is something that demands strong collaboration and coordination. It's a really strong basis from which to address a very challenging situation. And the University of California, Berkeley, we developed this concept of wicked problems back in the 70s. Riddle and Weber developed this idea, and the wicked problem is one that it doesn't have a solution. There are better and worse approaches, and the better approaches tend to be the ones that have consensus building in them. But a challenge when you're facing a pandemic is you don't have a lot of time to build consensus. But we've seen in the Denmark, for example, coming in response with its strong unemployment benefits that came out very quickly, and they built consensus around all the political parties came together and said that we're in this together, and they had the labor unions at the table and the employers. They're able to do that because of that public trust. And I would like to say, though, that we think a lot about, there's a limerick along the lines that says something, a foreigner is traveling in a foreign land, it's a tourist, and is out in a rural area and asks a local person, hey, how do you get to the capital city? And the local says in response, well, I wouldn't start from here. And that sometimes can be the challenge in the US, where we think, God, we just don't have trust. And here I would point to, the Nordics had some real challenges over the last 100+ years, but they started brick by brick building some of these universal programs, such as where folks had access to childcare and these sorts of things. Some of these policy measures actually were a means through which to build some of that trust. So I see this is a long-winded way of saying I have some hope coming from this, that I hope we can take this crisis in the US and look around the world and consider what might make sense in the US, some policies, some approaches where we can actually address this really fundamental challenge of lack of trust.
So one of the things that might be interesting in that regard is think about our own community in Berkeley. Think about the counties around here that really were the first to go into a lockdown or shelter in place, as we called it, situation. There has been, people really trust the regional health authorities. They really trust the municipal governments. They really have come to actually, maybe they didn't think about them before, but now they actually, wow, these are really right. Think about, I find absolutely amazing the extent to which the governor of New York has been able to create trust in New York City and throughout New York State. It's really quite remarkable. You would not have predicted that. So
Absolutely.
I would say, yes, maybe we can use this to build blocks of trust around the country. I really think so. So the different levels of the frameworks, and you've laid out. Is it too early? So you're a healthcare expert here. Is it too early to really evaluate which of these frameworks makes the most sense? What are we learning about
Yeah.
the different approaches to dealing with this pandemic?
Well, I think that's a great question because there's a lot of headlines that are basically already declaring Sweden's model failed because Sweden has more cases and more deaths than its Nordic neighbors. And I think, I think what Sweden might say is, well, we have 20 to 25% of our population who's already been exposed. So just fast forward, what you should be doing is you should be looking at when the other Nordics have that high a percentage of the population exposed to the disease, and you should see if their death rates are comparable. So they're sort of saying, don't compare apples and oranges. We actually have some immunity. We've bought some immunity with what we're doing. But one of the things that I think is interesting in thinking about what Denmark has done is that Denmark is, in some senses, I think Denmark gets it's potentially in this great situation that it can look at how Sweden approached kind of the herd immunity piece. It did hit pause. They did go shelter in place, and they are one of the first countries to start easing up. They were one of the first countries to reopen schools, for example, and they did that based on epidemiological evidence, early and uncertain, but some epidemiological evidence that kids are not a major source of transmission in this pandemic, and that kids going to school wouldn't actually really drive up their case rates, their transmission. And I think it's probably early to be able to tell if that's correct. I think if we don't see cases really jumping in Denmark in the next week or two, then we might say, oh yeah, it looks like you can open your schools without having everything fall apart. Or it looks like Denmark could open its schools without having everything fall apart. So I do think in some senses I guess it's two ways of answering the question. On the one hand, yes, it's too early to say who's successful and which model is the best. But I don't think it's too early for countries to be learning from one another. And I'm seeing a lot of countries in Europe that are opening in their schools, and they're doing it based on these epidemiological studies that suggest that, that for something like influenza, I think children are the index patient in a household in 54% of cases. So children are kind of a major source of transmission, which stands to reason because children have less exposure to seasonal influenza than adults. In this particular case, I think that some of the early epidemiological evidence suggests that children are the index patient, transmitting it to other people in the household, something like 9% of the time. So I think I'm hearing a lot of rumors and grumbling that people think that in the United States we might not even have our kids back in school in the fall, or we might not have summer camps open. But I'm hoping that some of the countries that feel like they've got transmission is low, they've gone through a first wave without their hospitals getting overwhelmed. They're sort of ready to kind of ease back into the economy, that those can be models for other countries to show where and how to do this sort of most effectively. So I wouldn't yet declare either Sweden or Denmark the winner. I think it's too early for that, but I think that everybody is learning from one another because all of the countries are sort of mixing different strategies, opening up different things at different times, and giving, similarly based guidance about how to do that well, hand washing and social distancing, but they're doing it kind of in a variety of ways. So there's an opportunity to learn for countries to learn from one another.
Do we know anything about, since masks have become a political statement in the United States, do we know anything about the use of masks in the Nordic countries? Certainly in Asia, certainly in South Korea, certainly in countries that have dealt with SARS-like, COVID-like epidemics before. People are quite common. They're used to wearing masks, and you see that on trains, 3 years ago. Here it's become a political statement.
Right. Right. Instead of just a means. Well, I'm really interested to hear what Robert would say. I think the only thing that I know sort of specifically about this is that we heard the public health officer, the state public health officer in Sweden, say that he doesn't believe the epidemiology that wearing a mask is all that effective. For, I think the CDC changed its guidance when it found that that people can transmit before they actually show any symptoms. And so the idea is, if you put a mask on yourself and you cough into it, it's going to catch the droplets. So you're going to spread less disease. Yeah. Obviously, wearing a cotton mask is not something that's going to help people in a healthcare setting, because it really doesn't. It's certainly nothing close to the kind of level of protection that you would want in a healthcare setting. But if everybody in the population is just wearing masks, whether they feel good or bad, you're likely to cut into the transmission. And that's, I think, many countries feel like that's what we want. We want to just chip away at the transmission, so that it's happening at a slow burn and isn't overwhelming any community, or, most importantly, isn't harming those who are most vulnerable. So I don't know how the Nordics overall think about masks, but in Sweden, they're like, we don't think it's going to help that much. And Sweden, I think they've said, if you're sick, stay home. So they're basically saying, you don't have to wear masks, just don't go out if you're sick.
And so there you'd have the trust element, because then people have to trust others who are sick to stay home, to protect. That is, I will protect you, the rest of my society, because I feel trust and cooperation. And Robert, do you know anything about the mask situation, or how it relates to people's sense of what they need to do for others in this situation?
Well, I think it's the trust certainly figures in there too, as well as the public policy here. And this is something that you get sick leave when you're in the Nordic context. And the government, one of the moves that they did in Sweden as well as Denmark, normally the first little while of sick leave is paid by the employer, but they switched that right away and said the state will pay for this. They didn't want any incentives for employers to have to bear the burden of this. They wanted folks, if you have any inkling, stay home. And so that's, a little bit of a different sort of a scenario that we see. Anne's correctly right. We were listening to the same webinar by the chief epidemiologist of Sweden, who's become quite a notable figure. And he offered that commentary that he didn't want folks to have a false sense of security going out. And you don't see masks in, for example, where the schools are reopening, as Anne had mentioned, in Denmark. But one thing that you see that it's different, and I really like this approach, and I think, why don't we do this here in California? And that is, they're holding classes more outside. So where you can actually have some social distance, and they have this, there's an adage, an old Scandinavian adage, there's no such thing as bad weather, just bad clothing. So kids should be outside. And that's something that I think is really, wow, we need to embrace this in California, and let's get together as a community. And Laura, I think you're spot on. We're seeing some really kind of beautiful things at a more local level coming out of this in terms of trust and coming together. Right. Let's shut down some streets during the day and have kids out, where set up some tents and we do school outside. And this sort of an approach to kind of embrace it, I think maybe we can actually see some opportunity out of this.
Okay, I'm going to encourage the audience now to issue some questions. I think we should turn a bit to the economics of this, because the truth is that the Nordic countries are maybe achieving different approaches to the pandemic. They are all going to suffer and are suffering from the economic hits associated either with the way that people change their consumption behavior, with the global markets in which they sell so many of their products. Everybody's going to take a hit on output, GDP, the sort of way economists measure. All of these countries are projected to have a negative year in GDP, recession. Different unemployment numbers, though, because, and this is I really want to underscore and get Robert to talk about, what Denmark has done, and they learned a lot from Germany here, is decided to pay companies directly to keep their employees employed. Robert, I think you should talk a little bit more about what made that possible even. Yeah,
it's quite remarkable that they were able to move so quickly from saying, we're shutting down, this was mid-March roughly, and where their prime minister and all the folks around the political spectrum came together in a matter of just a couple of days and said, okay, we will pay employers who do not lay off employees we'll pay them 75% of salary worker salaries and 90% of hourly workers' wages. And we'll do this for 13 weeks to the end of June, basically. And that's a massive amount of money. We're talking about roughly 13% of their GDP that they just said very quickly. And in US terms, that'd be roughly $2.5 trillion. But the whole goal here, of course, is they said the most valuable relationship that we have for an economy is the relationship between the employer and the employees. And we don't want to sever that. We don't want to sever that right away. And so it also speaks to the fact that strong labor unions, they were able to have that sort of ongoing basis. And then another thing is that at factor here, and this is something where I've had the privilege to go back and forth between the Nordics and the US context. And over the last 15 plus years. And one thing, when I first moved, this happened to be Norway 15 years ago, I recall I was trying to get paid for something. I asked somebody, well, couldn't you write me a check? And they're like, checks, we got rid of those 6 years ago. I mean, this was 15 years ago. So everything's digital. And that includes with taxes, and that includes the relationship between individuals and employers with government. So they have this mechanism in place, this infrastructure, where they can just very efficiently, without having to worry about whose name is or isn't on a check, they can actually just get the money to where it needs to be. So they can efficiently move very quickly with the whole intent of being able to turn back the economy as quickly as possible.
I think that's really important because I think that is going to be a real trend in the United States now. One of the lessons that we will be able to move forward on is digitizing as much as possible the relationship between the citizen and the government. And I think what we've seen, so the US we chose to sort of, instead of the Denmark approach, a lot of US economists said, okay, well, we'll do this, we'll give loans to small businesses to keep their employees. But that's really hard to do because a lot of small businesses don't have any connection to the Small Business Association, the small business, and therefore they don't have the ability to do that. It took them a long time, okay, and then we said, oh, we'll also do it in unemployment insurance. But it turns out that unemployment insurance is really hard. States have to run it. A lot of them didn't invest adequately in it. During the Great Recession, they cut back their administrative capabilities of unemployment insurance. You couldn't even do it. So all of a sudden we have this massive expansion in unemployment insurance, and people are on the phone for weeks trying to register. So I do think the administrative capacity of a policy is really important. And we chose a set of policies in the US where we were trying to get at the same thing as what the Danish did, to keep people employed, or if they're unemployed, give them insurance. That's serious. But we have a real administrative capacity problem. So,
and Laura, if I could on that, I think it's so important when we talk about the discussions in the US, oftentimes we talk about big government, small government. And I don't hear those kinds of discussions in the Nordics. It's more about smart policy and smart government. And if we're going to do something with a mechanism of the government, it better be efficient. And because of transparency and these sorts of things, the citizens hold the government up, because if they're not getting the service, the citizens are going to come and say, we're going to vote you out. So I think that this kind of fits with the public trust, as well as the transparency and strong democracies that we see in a Nordic context to make that possible.
And of course, you do have to pay for them. I want to underscore what you said at the beginning. There are very high levels of taxation here. The taxes are being used to support all of these programs, which the population wants, benefits from, and seems willing to pay for because it's efficiently delivered. So I think that's very important. I do have a question here on Sweden. It says that Sweden has a very high percentage of COVID deaths in the 60 plus age group. That's me being one of them, versus Canada and the US. Is the main reason for that just that they really failed in the healthcare, in the nursing home facility? What do we have any explanation for why Sweden has had this very high death rate, I think, contraction of the disease and death rate among the elderly?
I would, in some ways, I'm taking a guess here because I haven't looked at the side-by-side statistics, but certainly Sweden has said that 50% of their deaths come from the deaths in elder care facilities.
Yeah.
Also, I think younger people in Sweden aren't dying. So I think that the level of chronic disease that hits a younger population means that probably and this is where I'm sort of going on sort of I'm making a guess based on sort of general knowledge, and I haven't ascertained this looking specifically at the data, but it could be that the U.S. and Canada just have higher rates of death among lower populations. I mean, among younger populations.
Among younger populations.
Right.
And if we could, one thing, Anne, that we can add to this is slightly contextual differences. In Sweden, a lot of times folks will they don't go to nursing homes until they're incredibly frail. The municipality may deliver services to keep people in their homes, and as that chief epidemiologist suggested, there were some hygiene issues and things like this. So you had problems, and then they went to a very, very, very fragile population, and that really exacerbated the death rates amongst the elderly.
Are there nursing homes public institutions or private? So a lot of the nursing homes in the United States, most are private. So basically, these are for-profit institutions. Let's face it, that's what a private institution is here. Oftentimes housing people on Medicaid, so very, very poor population. So you may have a population that actually is challenged going in to a nursing home, which is privately motivated to keep costs down.
Yeah. You've given me a good homework assignment here, Laura. I don't know the answer to that, but I desperately want to.
Yeah, I think given that Sweden has, they as I said, they've accepted responsibility for a failure here, then I think thinking about the reasons is important. I also raised the issue, and we weren't able to find this out either. So anybody listening, I said, what is going on in the Nordics in the meatpacking area, which is another area where it turns out the U.S. seems to be having a massive problem. I don't know. We don't know the answer to that right now, but I mean, I think those are interesting questions. Let me go to a question from Ken Hayes, who points out something really important here on governance. So these societies are parliamentary systems, and they can bring parties together. They can vote party out of office. How would you say the parliamentary nature of their systems versus, say, the US system is affecting what's happening? I will just start with one view. I heard a very sobering statistic the other day from someone who's very well known in the running of political campaigns in the United States. He said that 90% of the population in the United States right now knows exactly who they're going to vote for, and that polarization in the United States on policy and on politics is greater than it is in any advanced industrial country, any. So how does the parliamentary systems of governance help or hinder? How does it affect the ability of the Nordics to respond to these kinds of common crises where all society is confronted with the crisis, regardless of political party?
Well, I can venture a little bit I can venture some guesses, and maybe Robert, you'll follow up and clarify some of this. I mean, in the United States, we're experiencing hyper partisanship, and with that comes sort of where our identities are so strongly tied up with partisanship that it's almost gotten to a level of sort of tribalism, right? You only accept information from people who you think are like you politically. And I would say that, potentially, obviously in parliaments, majorities, to control a parliament, you need to make a majority party. So if there are many more parties that are competing for seats in a parliament, but it could be that the coalitions that form, because they shift over time, they don't sort of lend themselves to this really super monstrously strong identity politics that seems to be overtaking the United States. And one of the things that I think is really, I think the way that our media is structured, and our media tends to really support, you can just select hearing a perspective that supports your own viewpoint. So we're sorting into kind of media domains in a way that reinforces this kind of hyper partisanship. I don't know that parliamentary systems we'll avoid that parallel media structure, but I think that the way that parliaments force governments to make coalitions don't lend themselves to this really strident kind of identity, sort of tribal politics.
And I think, Anne, I think you're spot on in that. And I'm generally an optimist, but here's where I'm a little more pessimistic in the U.S. context, that we tend to treat politics as sport. So it's my team versus your team, as opposed to what are we trying to achieve for the common good? And that's a different sort of thing that we see in a Nordic context. Generally speaking, the politicians are there and see themselves as public servants and trying to build, a better society. And I think that you have two things going for you. I agree, Laura. I think from a governance structure, I think the parliament it forces consensus building. It does force that and forces you to bring in. And there's some ugly times too, because you can get some really far right-wing nationalistic folks that have a little bit more of a presence because they're part of to form that coalition. That can happen. But when we see a culture in the US, I see a culture of conflict largely in our politics, and I see much more of a culture of consensus, and it's expected consensus amongst the citizenry in the Nordics. And so I think that they've got two things kind of going for them when it comes to addressing these problems that demand that sort of consensus.
Mm-hmm, mm-hmm. So one of the countries that we haven't talked about, and I'm not going to say a lot about, but I just spent much of the fall in Germany. So Germany, Robert mentioned that people tend to say, "Oh, the Nordics, they're small, they're homogeneous. I can't learn anything from them." I think Robert has correctly blown that myth out of the water. We can learn from these countries. In the German context, when I was there was a lot, the Chancellor Merkel was losing popularity. There was divisions going on in the SPD. There was the rise of a very radical right-wing fascistic party in the eastern parts of Germany. Essentially, it appears to be the case that the shared response to a shared crisis and a shared common good is actually bringing these fraying coalitions back together. So the ability to form consensus in a coalition situation where you have a shared vulnerability, I think is we're seeing that in a very big economy, which, by the way, also is going to suffer. So the truth is, from a global economic point of view, there is no country that can really hide here. And that means that we're comparing how they deal with the health crisis, how they deal with the educational crisis, how they deal with the economic crisis, but everybody will suffer from some part of the economic crisis. And I think that those of us who, I guess we can kind of end here unless there's another question. I mean, a lot of people do draw an analogy. It's certainly not a perfect analogy between the depth of the economic challenge in the Great Depression, very different causes, and the depth of the economic challenges that as we get out of this. I would say the right way to think about it, it's an induced recession. It's a recession that was induced by the efforts of countries around the world to use these very different mechanisms that Anne laid out to try to grapple with this pandemic. And they're still trying to grapple with it. And there's a lot of economic cost associated with the ways that we have done this. So I think that's maybe an important place to end. I just want to make sure, though, that Anne and Robert, do you have any insights you didn't get a chance to share that you'd like to share with our audience?
Sure.
Go ahead, Anne. Start.
I'll go. Okay. One of the things that I think we haven't really talked about is that there isn't really a national response happening in the United States. Yeah. We're seeing governors take the lead. We're seeing states sort of go their own way with respect to easing up the economy. But we are one country. We are contiguous states, and what happens in one state will spill over into neighboring states. And so that the sort of lack of leadership and national articulation of a strategy is just an enormous difference when we compare what's happening in the United States with the Nordic countries.
Robert?
if I could just to frame us and say, what do we do from here? So there's the immediate term, and then there's after this mess is behind us. And I think before the phase of after this mess is behind us, for us to think, what is the society that we want to construct? What are we trying to build here? Mm-hmm. And I think we can draw such inspiration from the Nordic experiment that went from 5-6 generations ago in poverty to building these robust, resilient economies and societies in places that are arguably freer because folks have choice and have social mobility. And I think that we can look here in the United States, what makes sense for us. And Anne referenced a really important factoid. If we just focused on, we're spending 18%, roughly 17, 18% of our GDP on healthcare, and we're not getting better outcomes. Yeah. Rather than looking around the world and trying to get more people to spend more on military spending, we can just, why don't we get back down to like 11% of spending? And how do we do that? We need more of a systems response. And we push these problems at the US level. Every problem goes down to the organization or the individual level. But these are systematic problems and challenges that we face. So let's build systems to respond to them. And those systems can be more efficient. And we have some great examples. We can look around the world. And here's where the US, I think part of the reason that we treat politics as sport and are so conflict-based, we love competition. We love competition here in the US. So let's appeal to that competition and say, you know what, we're getting beat right now. We are getting beat. And so let's look elsewhere and let's see, how can we actually achieve greater efficiencies and build a society that more of us want to live in? And I think we can draw such inspiration from the Nordics.
Wow. Well, thank you both, Anne and Robert. You've ended us on a really optimistic, forward-looking.
We're going to do it.
We will learn from this in a way which makes us better. And I really want to thank you on behalf of the Berkeley community for doing this. I want to note that we've had the Berkeley Haas Center for Responsible Business involved in this. We've had the Berkeley Department of Scandinavian. We've had the Institute for European Studies. We've had the Peter Sather Center, and a group has come together to help us put this conversation on for you, and we hope that all of you in the audience have really benefited. I know that I have learned a lot. Thank you very, very much.
Thanks so much, Laura.
Thank you so much.
Pleasure to be here.
Take care.
Such a pleasure. Thank you.